There's good news and bad news when it comes to monkeypox. The good news, it's not spread nearly as easily as COVID-19, which spreads through the air and is highly contagious. It's also not as severe. So far, there have not been any deaths from monkeypox in the U.S. The bad news is it is extremely painful and it could lead to worse infections. But anyone can catch it, and only through very specific ways. We'll get into that in a moment. Doctors say they expect monkeypox is going to be in the community for months, maybe even years. So let's get to those specifics. First, the basics. What monkeypox is and where it came from. According to the CDC, monkeypox is part of the same family of viruses as smallpox, but it's much less severe and rarely fatal. Monkeypox was first discovered back in 1958. It was noticed in monkeys, but researchers say they believe it actually comes from rodents. The first human case was recorded in 1970. Before this year, monkeypox was reported in several countries in Africa. Earlier this year, it started spreading across the U.S. as well as other countries around the world. Here's a look at the current spread. Those orange circles there are areas where monkeypox is reported that have not historically seen cases. The blue circles on your map are areas where the virus has been seen in the past. Right now, there are more than 31,000 cases across the globe, the vast majority in places where it has not historically spread. There are 11,000 cases in the U.S. right now. In Oregon, at last check this afternoon, 95 confirmed cases. 57 of those are in Multnomah County, and in Washington state, there are 251 cases. The vast majority of cases are in men. In Oregon, only 3 of the monkeypox cases are in women. Doctors say monkeypox is spread primarily through prolonged skin-to-skin contact. Right now, they're seeing the most transmission through sexual activity, but it can be spread through any skin-to-skin contact. Again, it's rarely fatal, but this is not an infection that you want to take lightly. Here's Dr. Dean Seidlinger with the Oregon Health Authority to go over the symptoms and warnings, and we're going to show you some pictures and describe some details, so be warned.
Monkeypox may start with a fever, achiness, or a sore throat, but it may also start with a rash or sores. The rash often looks like pimples or blisters at the start. The rash will eventually get firmer and may be very painful. If you're feeling sick and notice any new rashes, especially on the genitals or around the anus, avoid close skin-to-skin contact with others and talk to a healthcare provider or call 211 if you don't have one.
Now let's talk about how it spreads, because just like we saw with COVID-19, there's a lot of misinformation out there. Doctors say they're seeing the most cases between gay and bisexual men. That's across the country, and it's happening right here in Oregon. But even if you're not gay or bisexual, you're not exempt from the risk.
This means that anyone can be affected by monkeypox, and this is not a gay disease. But as I shared earlier, this is not an easy disease to catch. The most common means of person-to-person transmission is from prolonged skin-to-skin contact with a person with monkeypox, including direct contact with a rash, scabs, or body fluids. This is the type of contact that happens during sexual activity. Much less commonly, the virus can also be spread by touching objects, fabrics, and surfaces that have been used by a person with monkeypox and through contact with respiratory secretions of a person with monkeypox. These routes are much less common than skin-to-skin contact with someone who has monkeypox.
Advocates for the LGBTQ community say there's been a lack of urgency from health officials in getting information, testing, vaccines, and treatment out to the people most affected. And they say they're afraid it's soon going to become a bigger problem.
The OHA and CBOs like the Acme Institute, Cascade AIDS Project, Pride Northwest, and others have been sounding the alarm, and the lack of urgency from the federal government is concerning. Would that urgency look any different if it wasn't impacting a historically marginalized community? Did we learn nothing from the AIDS epidemic? I'm hearing straight people say they don't have to worry about it because it doesn't affect them. At this point, it is not an if, but a when it will start affecting other communities. Gay, bisexual, queer men, and trans people are not the only people engaging in skin-to-skin contact or having sex with multiple partners. Look at the World Naked Bike Ride that just happened.
Oregon Governor Kate Brown weighed in as well. In a statement she wrote, We have an ugly history in this country of ignoring diseases that primarily impact the LGBTQ plus community. I remember the early days of the HIV epidemic when a generation of gay men was dying and the government did not seem to care. It took years before there was general recognition from the public that HIV, like all viruses, spreads indiscriminately. She called on the federal government to speed up the delivery of vaccines and treatments and for people to take steps to protect themselves. There is a vaccine for monkeypox, but it's not easy to get. The supply is limited right now. Health officials say they're doing what they can to spread it out, including only giving 1 dose instead of 2, and they're prioritizing people who are in high-risk groups rather than vaccinating the general public, for example. Oregon has so far received 6,800 vaccines and distributed a little over 2,000 of them. So, what do you do if you think you've been exposed? Well, you could call your doctor or 211 if you don't have a doctor. You'll get tested. The testing involves swabbing the rash or sores. The test takes about 1 to 3 days to get results. If you have sores or a rash, you should cover them and don't touch them. The doctors say you'll need to isolate until all the sores or scabs are scabbed over and go away. There's also a treatment for monkeypox. It's called T-pox, but it's not easy to get a hold of right now. One more thing to think about, kids with monkeypox. Oregon health officials say right now there are not any pediatric monkeypox cases in the state, but as school starts soon, they're having conversations about how to handle any cases that could come up. But that school is a low-risk setting.
Younger children or any children who are cared for by a parent or caregiver in a household who has monkeypox, that transmission could occur. And we worry especially about younger kids who require more close contact with their parent or caregiver. And some parents who are sick, don't have an alternative caregiver, don't have someone else who can take over that duty for caring for the youngest child. So we are having discussions with our Oregon Department of Education colleagues, but we don't anticipate that schools will be a location where monkeypox transmits commonly. But we do anticipate that whether it's a staff member or a student, schools will have to face issues where someone with monkeypox may have been on campus. What would put individuals in that school community at risk for transmission are things like close skin-to-skin contact. That happens in several situations in schools. For example, wrestling. So if a wrestler had lesions and were participating in practice or a tournament while they had those lesions, we could see transmission.
Dr. Seidlinger says they're working with schools on how to support students and teachers who may need to isolate for several weeks and how to reduce stigma around the infection. So what questions or concerns do you have around monkeypox? We'll try to answer them for you. All the ways to communicate with us right at the bottom of the screen there. You can email us. The address is thestory@kgw.com, or use the hashtag #TheStoryKGW on Twitter, or leave us a voicemail. Call our phone number 503-226-5090.